Hello, I'm Anne Mackey, Director of Screening at Public Health England. We're here to talk today about preventing and diagnosing bowel cancer. Bowel cancer is the third most common cancer in men and women and the second biggest cancer after lung cancer, killing an average of 35 people every day. I'm joined today by Deborah Alsina, Bowel Cancer UK Chief Executive, Dr. Sean McGee, Chair of the Colorectal Site-Specific Clinical Reference Group, and by Stephen Halloran, Professor Emeritus of Surrey and until recently Director of the Bowel Cancer Screening Hub for the South of England. Sean, if I could turn to you first then. As Chair of the Colorectal Site-Specific Clinical Reference Group, could you give us some insights into the incidence of bowel cancer and who's affected?
Well, as implied in your introduction, bowel cancer is a very significant health concern in our population, and in 2014 it accounted for 11.5% of all cancer registrations. So without question, this is one of the more prevalent cancers, being the third most common in both men and women. The incidence, however, is much higher for men, 84.5 compared to 56.4 per 100,000 population for women. Bowel cancer tends mainly, but not exclusively, to affect those in their middle or later years. 94% of cases occurring in people over 50 and 83% in people over 60 years of age. And in terms of its overall impact on health, we need look no further than the fact that bowel cancer is the second most common cause of cancer-related death in England, after lung cancer. In the past 10 years, we've seen an increase in the incidence of bowel cancer, but we've also started to see significant improvements in mortality. And currently, about 3/4 of men and women can expect to survive 1 year following diagnosis, with approximately 58% surviving 5 years or more. But I believe that we can and should strive to do even better than this.
Thank you very much, Sean. Deborah, what do we know about reducing the risk of bowel cancer?
At Bowel Cancer UK, we're aware of several risk factors which increase risk of bowel cancer, and perhaps the three most important are age, genes and a Western diet and lifestyle. So whilst there's very little we can do about increasing age or the genes that we inherit, apart from being aware of and seeking advice on strong family history, there's good news in terms of lifestyle. Evidence suggests, in fact, that around 50% of bowel cancer cases could be prevented through simple changes to diet and lifestyle. And these include that everyone should eat a healthy, balanced diet, avoiding processed meat and limiting red meat intake. We should also limit the amount of saturated fat in our diets and eat plenty of fibre from whole grains, pulses and, of course, fruit and vegetables. It's also important to keep to a healthy body weight. It's also recommended that everyone who can should do at least 30 minutes of physical activity a day, perhaps at least 5 times a week, something such as brisk walking perhaps. And that's because physical activity can help stack the odds against bowel cancer and many other conditions, and it can make you feel great too. It's often starting that's difficult for people, so we'd highly recommend that people start with a pedometer or perhaps using a fitness app to just get some initial motivation. Smokers should stop, because an estimated 8% of bowel cancer cases are linked to tobacco smoking, and your risk increases with the numbers of cigarettes you smoke every day. One of the reasons for this is that we know that smokers are more likely to develop polyps, which are precancerous growths in the bowel, which could, if discovered, not discovered, turn into bowel cancer. Alcohol is another risk factor, and it's estimated that around 11% of bowel cancer cases are alcohol related. So it's highly recommended that people don't drink more than 14 units a week, ideally not every week, and actively try and reduce their alcohol intake.
Thank you, Deborah. Sean, you mentioned how 3/4 of people survive for 1 year post-diagnosis. What difference would early diagnosis of bowel cancer make?
Well, we know that there's a strong, clear link between early detection and improved survival. And this encourages us to believe that effective early detection initiatives will result in better outcomes for patients with bowel cancer. For an individual patient, there are currently several possible routes to their diagnosis. Their GP may refer them urgently on the 2-week wait pathway because of worrying symptoms. Diagnosis may also follow bowel screening or happen following a routine GP referral. Sometimes, however, the cancer isn't picked up until very late, and such patients frequently present as emergencies. In 2013, 30% of bowel cancers were diagnosed through the 2-week wait pathway and 9% through bowel screening. And via these routes, the cancer is much more likely to be diagnosed at an earlier stage, such as stage 1, particularly so by the screening route. By contrast, however, 23% were diagnosed through routine GP referrals and 24% as emergency presentations. Cancer diagnosed in this way is much more likely to be at an advanced stage, such as stage 4. Now, the significance of this is that 1-year survival for both men and women diagnosed at the early stage 1 is 98%. But when detected at stage 4, when the cancer is much more advanced, 1-year survival falls to 44% for men and only 35% for women. We also know that 1-year survival for all cancers detected through bowel screening is 97%, but through emergency presentation is only 49%. It follows, therefore, that directing efforts to increase uptake of bowel screening and diagnosis via the 2-week wait pathway can be expected to result in more cancers diagnosed earlier, at an earlier stage, and that this will impact significantly in a positive way on overall survival. Our population data suggests that it's the patients from more deprived areas, together with our youngest and oldest patients, who are more likely to present as emergencies and less likely to present through the screening route.
Thank you, Sean. Stephen, so this year we're celebrating the 10th anniversary of bowel cancer screening. Could you describe it and explain why it works?
Well, yes, there are two elements to the screening programme. In England, we're doing bowel scope screening. That occurs at the age of 55 and is designed to prevent the development of cancers by detecting polyps. And then secondly, we have fecal occult blood testing, which is designed to detect cancers early and occurs between the ages of 60 and 74. Now, both of those screening activities depend upon the slow development of colorectal cancer. There's a window of opportunity that is exploited by screening. Bowel scope screening uses a endoscopy technique, examines and finds the presence of polyps, and then allows their removal. So no chance of cancer developing. Whereas in guaiac-based testing, we're looking for the presence of blood produced by either cancers or polyps that we know bleed, and we have the opportunity then to remove them. Guaiac-based testing, in England, we do it every 2 years. An invitation goes out to people between the ages of 60 and 74. They're required to provide a small sample on 3 occasions. There are a small proportion, around about 6%, that will need that to be repeated because the results are unclear. 2% will be positive, and if they're positive, they're referred to an appointment with a colonoscopy nurse, and if everything is okay, they'll go on and have a colonoscopy to look for the presence of cancer. About 1 in 10 will have cancer, and around about 40% of those who have colonoscopy will have a polyp of one sort or another that will be removed. We've detected 25,000 cancers since the programme began, and 81,000 precancers, advanced adenomas.
Thank you. Deborah, would you mind reminding us of the early warning signs of bowel cancer?
Yeah, of course. And it really is, it's an important point to highlight because early diagnosis really does save lives, as some of the statistics have been showing. So the key symptoms that people should be looking out for, both the public and professionals, are bleeding from the bottom or blood in your poo. You might see that on the toilet paper. A change in bowel habit for 3 weeks or more, so something that's not normal for you. A pain or lump in your tummy, or unexplained weight loss or extreme tiredness for no reason. And of course, it's really important to remember that you may experience one, some, or none of those symptoms. But if something doesn't feel right, take advice from your GP. And it's also important to remember that most symptoms will not be bowel cancer. I think for professionals, it's also important, we talked earlier about risk, and I think it's important to stress that whilst most people are over the age of 50 who develop bowel cancer. In fact, 2,400 people are diagnosed under the age of 50 every year in the UK. And through Bowel Cancer UK's Never Too Young campaign, we've really identified that about 60% of younger patients are often diagnosed at the later stages of the disease, stages 3 and 4, 34% as an emergency. And so it's important to remember that whilst under 50s are low risk, they're not no risk. So if somebody presents with symptoms of the disease that could be bowel cancer, that they should be ruled out quickly within the diagnostic pathway.
Thank you very much. Stephen, we know that the uptake of bowel cancer screening isn't very high, and in some places as low as a third. Could you just talk us through some of the sorts of things that might explain that, and then what we might do to address it?
You're right, it isn't as good as it should be. It's much better than many other countries. During the long period of time that I was a bowel cancer hub director, I received many hundreds of letters from the public explaining why they were not going to do the test. It's true to say that some people, I think, have good reasons for not doing the test. Their family commitments are such that at that point in time it's appropriate. It's not appropriate. But many people have a fatalistic view. Their view is that if cancer arrives, well, they will respond appropriately at that point in time, but up to that stage they're not going to do anything. There are individuals who believe that unless you have symptoms, doing the test really isn't going to be of any value. There's a group of individuals who believe that their diet is such, they have a good diet, they perhaps take vitamin tablets, they're exercise fiends, and therefore they're not going to get cancer, which sadly is not the case. So it is an issue, and men particularly are a problem, and probably because they just don't like the idea of having to collect a sample of poo and put it onto a card. So what can we do? There's good evidence that if you have a motivated GP who can find the time to discuss it with the patient, then they will improve uptake. There's no good evidence to show that just simple communication through a letter is going to make a significant difference. The current programme uses a guaiac-based test, and we've recently piloted the use of a fecal immunochemical test, and that made a dramatic difference. We saw an increase of 10 to 12% in men who have been invited for the first time. We saw a doubling in uptake of those individuals who had previously chosen not to do the test. And even amongst the population who've been compliant, we squeezed another 4%. So they were over 90% uptake. So there's no doubt that FIT works. And what is FIT? Well, FIT is a new test that still uses the same principle of detecting blood, but it can detect it in a more sensitive and more specific way. It can be done in an automated fashion so that the test is more reliable, and it can detect more cancers, and it can detect even earlier stages of cancer. And of course the good news is that earlier on this month the Public Health Minister, Jane Allison, announced that FIT was going to be adopted in England, and we're expecting that perhaps it will arrive around about April of 2018.
Thank you, Stephen. Thank you very much, everyone. We've heard how bowel cancer is the third most common cancer in England and the second biggest killer. The 1-year survival for cancer detected through screening is as good as 97%. This year is the 10th anniversary of the bowel screening programme, during which period over 25,000 cancers have been detected. The recent announcement that the 1-sample FIT test is going to replace the current 3-sample test is expected to increase the take-up of bowel cancer screening. At Public Health England, we want to see fewer people developing bowel cancer, and we want to encourage more people to come forward for screening and achieve an uptake target of 75%. Do please take time to explore this edition of Health Matters, which describes the specific public health priorities and developments in the bowel cancer screening and prevention programme and how different stakeholders can contribute to improving uptake. It includes links to a variety of practical tools, infographics, case studies and blogs. Thank you for watching.